Hello everyone, my name is Sollyn and today I will be presenting population level health education intervention. My two topics are hypertension and nutrition. Backgrounds and significance. Approximately one-third of US adults have hypertension and only about half of these adults have their hypertension under control. Hypertension is an important common risk factor for heart disease and stroke, two of the leading causes of death in adults. Thus, it is important for us as a healthcare provider to educate those with hypertension on how to properly manage their illness. High blood pressure is classically called the silent killer because many times this condition often lacks of warning signs. In my windshield survey, I observed that the population seems to want to eat things that are quick and easy, such as fast food and all-you-can-eat buffet restaurant in the community. Many adults who live alone have no time to cook, thus they look to easy meals that are probably high in saturated fats and sodium that contribute to their chronic illness, which is hypertension. A number of dietary factors increase the risk of hypertension, and it is identified as having a high intake of salt, alcohol, and low consumption of fruits and vegetables. Healthy People 2020. For hypertension, improving awareness of hypertension, blood pressure adherence, and self-management strategies can lead to prevention of stroke, heart failure, and mortality. For nutrition, American Heart Association emphasizes fruits and vegetables as the key components for controlling hypertension because they are packed with healthy vitamins, minerals, fibers, and also access to nutrition food is also necessary. Needs assessment. Time and budget constraints are the driving factors that shape the population on decision-making process. In the long run, frequent consumption of meals high in salt, fats, and cholesterol will result in hypertension. Regardless of its convenience, its adverse outcome outweigh specific quirks. In order to reduce the prevalence of hypertension within this community, it is vital to assess the needs of population. Members of the community are in the lack of accessible and affordable resources to creating healthy heart meals. For instance, the community needs more grocery stores with affordable fresh fruits. In turn, improving accessibility to fresh produce will cause members to make more healthy decisions, which over time may become embedded good habit. Moreover, there is a sense of urgency to educate this growing population of individuals with hypertension. Theoretical framework, I used the Proceed model on this project of health education intervention prevention. It's an excellent model for the health promotion approach, includes step-by-step planning process, an organized approach for health promotions. It defines outcomes and adjusts the intervention to provide the appropriate outcomes based on the issues that the population is facing. Issues, the only barrier I encountered on the day of my presentation was when one of the participants was unwilling to participate in my educational presentation. He refused to receive a pamphlet as he said he did not need it and he would not read it anyway. But when I started my presentation, by instructing the audience to look at the first page of the pamphlet so that they can follow along with the lecture and ask any question if they have any, and this particular participants asked me if there's an extra pamphlet, In that case, he participated by using the pamphlet and asked questions. Even he participated in the discussion questions and answer game with incentives. Overall, it went well as everyone was able to participate and learn. Intervention for hypertension, I provided and donated a blood pressure machine to help demonstrate how to measure their blood pressure in appropriate time and improve their knowledge about hypertension. And also I emphasized the common causes of hypertension and emphasizing the modifiable risk factors such as smoking, amount of alcohol consumption, obesity, sedentary lifestyle, and diet. And also explain to them how they can improve and prevent further complication by changing their diet, quitting smoking, reducing their consumption of alcohol, and moderate exercise for at least 40 minutes for 4 times a week. Also, advantage of the community program of like exercise such as ballroom dance and aerobic exercise for adults every Friday. In nutrition, dietary approach to hypertension dash, I provided them with a dash eating plan goals for 2,000 calories a day diet. This can be achieved by limit foods that are high in sodium, calories, and saturated fats. Also, emphasize the increased consumption of fruits and vegetables, techniques to increase intake of fruits and vegetables by buying more fruits and vegetables. I encourage the community to take advantage of healthy eating with Human Services Association every weekday, such as with lunch minimal fees. Budget, approximately $80 main cost for teaching supplies or materials, including snacks. Teaching presentation with voluntary nurses and medical students is important. Volunteer nutritionists to teach them about nutrition at least twice a month is very critical for this community. Project evaluation outcome measures, goals and objectives. For hypertension, short-term goals by the end of the health promotion class, 80% of participants can demonstrate and verbalizes how to check blood pressure prior on taking high blood pressure medication in a timely manner. By the end of the health promotion class, 80% of participants able to verbalize their knowledge about hypertension management, such as practicing increasing physical activity and healthy diet. Long-term goals is by the mid of the year, participants will improve their blood pressure by maintaining a systolic blood pressure of less than 1/4 millimeter of mercury and diastolic blood pressure of less than 90 millimeter of mercury. For nutrition, the short-term goals are by the end of nutritional class, 80% of the participant can state foods that are low in saturated fats as well as fruits and vegetables rich vitamins and minerals, fibers. By the end of nutrition class, 80% of the participant can state the importance of modifying their diet to DASH. The long-term outcomes for nutrition by the mid-year of 2019, participants will demonstrate healthy eating habits with an increase of consumption of fruits and vegetables, as well as reduce their consumption of salt, sugars, and saturated fats, as well as maintaining healthy lifestyle. Results and conclusion, participants were educated on improving awareness for hypertension and how to manage their hypertension, making healthy choices of foods, emphasized the incremental changes in their diet to increase long-term benefits. The ultimate goal of this project, participants improve their knowledge, awareness, understanding the risk factors of hypertension, and make healthy choices to manage their hypertension. Here are my references, and here are my pictures. Thank you so much for listening.